Nursing home administrators tell us they were shocked when they got this letter from the state saying the emergency COVID money Congress allocated for them is going away and is instead ending up in some other state coffer. Right out of the gate, nursing homes were on the front lines, trying desperately to beat back the deadly coronavirus, struggling without protective gear, testing, or enough staff. Hundreds of elderly have died in these centers. Congress stepped up to the plate, authorizing millions of extra dollars, dramatically increasing money per day for every Medicaid-funded resident. In Washington state, that meant $29 per day per Medicaid resident. Now, the state has decided to slash that funding to just $5 a day, and nursing homes are worried that could go down to zero.
Our state needs to prioritize seniors and making sure that they're safe.
Alyssa Odegaard is a vice president of the advocacy group Leading Age Washington.
I mean, what was your reaction to that?
It was mind-blowing. We know that this virus disproportionately impacts those living in congregate care settings, in skilled nursing facility and other long-term care. And they need, the most support right now from our state. And so how you could then take the money that's going to care for them during this emergency, it's hard to even understand what the logic behind that was.
So without the ability to admit new residents, on top of all the other costs for protective gear, staffing, and testing, many nursing homes are wondering how long they can hold on. In Seattle, Susanna Frame, King 5 News.
The governor's budget office wouldn't say exactly where the extra money is going, but that they reduce the money to be more fiscally responsible and to keep future spending cuts at bay.